room any bigger, so.
Next time we will.
My name is William McIver, I'm the site manager here at Edson Healthcare Center. So I want to thank everybody for coming. It's a great day, I think, for Edson, one that a lot of people have waited a long time for. I think you'll come away with a sense after today that we're taking one giant step today towards realizing a dream that a lot of you folks have worked on over the years. So I'm pleased to fill in for Shelley Push, who's not feeling well right now. So I'll try to do the best that I can. So today we have representatives from Alberta Health Services Board, community and government to talk about the new facility. And after we wrap up the media wishes, there'll be time for interviews and what have you. So with that, I'd like to introduce the Honourable Ray Daniluk, Minister of Infrastructure. And representing our Alberta Health Services Board, please welcome Dr. Campbell, Gangopedia. No stranger to most of us, West Yellowhead MLA Robin Campbell. And representing the Town of Edson, Mayor Greg Paczynski. Councillors Kevin Sahara, where's Kevin? Jean Chenard. Tammy Strain. And Jim Gomolka. And Councillor Brian Boyce. We also have in attendance today a number of our volunteers from the Foundation of AIDS Auxiliary, who obviously are a key part of our team here. The work you folks continue to do is excellent work, and I know that the residents and the staff are very appreciative of the work that you do. So thank you for that. And we also have representatives from the Tamarack Health Advisory Council. I think Martin Williams is here somewhere. True. And to my right, we have Lana Hadley. Lana is the Director of Community Rural Hospitals in the North Central Zone. Chief of Staff, Dr. Jermaine Robinson. So we'll begin with our first speaker. It's a pleasure for me to introduce from the Alberta Health Services Board, Dr. Gangopedia.
I want to thank you all for coming in and attending this big event, and I want to recognize again Honourable Mr. Ray Daniluk, the Minister of Infrastructure, and also Honourable Robin Campbell, MLA for West Yellowhead, and Edson Mayor, you know everybody, Greg me, and Gerald Soroka, and Evan Strong. It is my honor and privilege to bring greetings and congratulations on behalf of the Alberta Health Services Board and Chairman Ken Hughes. The Edson Healthcare Center has been many years in the making and is the result of a great deal of vision, hard work and determination by staff, physicians, community and the Alberta government. Alberta Health Services has three main goals: access, quality and sustainability. And all three will be well supported here at the new Edson Healthcare Center. Sharing of space and co-location of various health professionals in the healthcare design will support a primary care model. The new facility will bring together community, health and wellness, primary care and acute care. This kind of integration of programs and services is the future of healthcare of Alberta. It will provide improved access to the right care at the right time. The community health and wellness programs and primary care are just as important as acute care beds in keeping people healthy. Health includes prevention, healthy lifestyle, and many other factors. One of the most important shifts that you will see in the healthcare delivery of Alberta in the years to come is a focus away from a sick care system towards becoming a wellness system. We on the AHS board know that the best health care is the care that prevents people from getting sick or injury in the first place. And of course, when people are sick or injured, they need good access to quality acute care as quickly as possible. Bringing all these programs and services together in one place will support a strong, patient-focused, collaborative team approach to the care of patients and families for the residents of Edson and surrounding communities. And it will take place within a purpose-built space, built to best practice standards with advanced technology to equip our frontline staff with the tools they need to provide the best quality care. We look forward to watching this wonderful facility being built and to the grand opening. Thank you all.
Thank you, Doctor. And we'll call up Mayor of Edson for his speech.
Just real quickly, I just want to make sure that people understand too, as much as we are part of them, they are part of us. The mayor of the county, Gerald Straka, and his council are here as well today. So. That's a good point, and I should point out a colleague as well from Whitecourt, the mayor of Whitecourt, Trevor. Thank you.
He's on the note of last
year. Today is a very exciting day for the town of Edson. It's been a lot of years. When I first got elected, the first thing I said to Ivan, I said, we gotta get in there and talk to the minister. And I've met several health ministers and all kinds of different people. I kept going to the city and knocking on doors and getting involved and talking to people, and it was a lot of work. Ivan, he pounded the grounds a long time ago. Robin took over and he heard the message loud and clear from Edson, says, what about the hospital? What about the hospital? Well, today we have an amazing announcement. People in the community have been going to me, Greg, do you believe it this time? Is it really going to happen? Oh, how many signs do we have to erect? And my number one response to people is, I'll tell you the difference. I said, it took me a few years to learn how this all works. But in the world of hospitals, Alberta Health Services runs the hospitals and Alberta Infrastructure builds the hospitals. So the difference we have this time is Alberta Infrastructure is the ones who made the announcements. They've made the investment in this community. They've purchased the lands. A beautiful location within our community. It's going to happen this time. Mr. Danilek, thank you very much for making the trip to Edson. He told me in the vehicle on the way over here, he says, it's going to happen. I believe it this time, and I can assure you, if it doesn't happen this time, there'll be one mad mayor. I'm a big guy, and he's a big minister, but very pleased today. Thank you for making the trip. Thank you very much, and thank you all.
Okay, next we'll have up our MLA, Mr. Robin Campbell.
Thank you, everybody. It's a pleasure for me to just be in Edson. People say, are you excited? I can tell you I'm more relieved than I am excited. This has been, when I first ran for election 3 years ago, I knew that one of the priorities in Edson was to get the hospital up and running. Gene, you let me know that loud and clear. Evelyn, I mean, every time I saw it, we said, where's the hospital? So for me, it's a sense of relief. I want to thank Ivan Strang, our retired MLA, for the work that Ivan did. Ivan was MLA for 11 years and did a lot of work in this riding and working towards the hospital. Of course, I want to thank the minister. I want to thank Greg, the mayor, for the work he did. Greg and I have a really good working relationship, and we've done some good things for this community, this just being one of them. I want to thank our premier, and I think there's a couple things that we should know. Number one is that the premier had the foresight and the vision to put away $17 billion. This hospital is being built with cash. There's going to be no debt when this hospital is done. It's going to be built with the cash that our premier put away. Also, when you sit in caucus and you run caucus and sit beside the premier, you get to tell him things. So every day I said, Edson, Edson, hospital, hospital, hospital. So he got the message. But he made a commitment to a number of communities, and Edson being one of them, that we made promises that we're going to build things. It was time that we built them. So, you know, there's 5 other hospitals going up in this area. I'm very pleased that the hospital that we're building here in Edson and the hospital we're building in High Prairie are going to be prototypes for the province as we look at primary care networks. We're moving all of our long care people over to the new facility, so I'm very pleased about that. That's all I have to say, because I promised my colleague and the Honourable Minister, Ray Daniluk, that I'd give him a lot of time to speak, because he says in caucus he never gets to speak when he puts his hand up. So it's my pleasure to introduce the MLA for Lac-La-Biche St. Paul, the Honourable Ray Daniluk, Minister of Infrastructure.
Right, by the way. What happens, he doesn't allow me to speak, and so, of course, you're going to have to be the brunt of me having suppressed expression. So I will talk about a couple things about this hospital. But first of all, I want to very much mention a little bit of what Robin did. When the Premier made me the Minister of Infrastructure, he basically called me and he says, I just want to tell you a couple things that are very important. The number one thing I want you to do is to finish some of the projects that have been started. Some of the projects that have been talked about, some of the projects that have been needed, some of the projects that the MLAs in their constituencies have been talking about. And we have been talking about Edson for a long time. And Edson is one of those projects. And I will tell you, Edson will be built. I want to say to you that, first of all, I want to bring greetings on behalf of the Premier. Just as so happened, the Premier called me as I was walking in here, and about half of you were in it. And he had some other meetings, but he was going in between 2 meetings, and he says, how's it going? And I says, going great. He says, right on. He says, because he wanted to be here, and he sends his regrets, but he also sends his congratulations. I also want to thank Mayor Greg and, of course, Mayor Gerald for the work that you're doing in your councils. It is critical to getting the message forward. These hospitals would not be built if it wasn't for the support of the municipalities and the work that individuals are doing, carrying the message of local communities. That is critical, and your representatives are doing a great job. And I also want to, as Robin said, I don't think there has been anyone that I have ever known that has been so tenacious, if I can use the word, as Ivan Strang in regard and representing a community and the needs of the community. So Ivan, you know, I want to say to Robin, but I also want to say this one's for you. Thank you. I also want to thank the doctor, and I'm sorry, I'm not even gonna start how you would say Kamalish, Yangopadia.
That's pretty good.
I figured that Ukrainian names were hard enough. I also want to thank the Alberta Health Services and Alberta Health Wellness that are going to be working very close in conjunction in the building of this hospital. As was said before, Alberta Infrastructure builds the facility. Alberta Health Services runs the facility. So when we look at what is necessary, there are certain things that are going to happen. Importantly, that, I'll go through a little bit of the process in a second, but most importantly to work together. But I want to say something a little bit on the other side, and I want to say today is Valentine's Day. It is fitting because over the years, according to some sources, people have invoked Saint Valentine's to bring about healing and to prevent illness. So this is an ideal day to celebrate the good news about your health center. So what a perfect day. So let me also say that I'm pleased to announce the purchase of the land for Edson's new $108 million healthcare center. The Alberta Infrastructure has secured, as was mentioned previously, 87 acres, which we think is an excellent spot. It offers a lot of room, and we wanted to make sure there was room for expansion and room to be able to provide the services. It has a perfect access between Highway 16 to the south and Highway 748 to the north. It also has a greenfield site. It allows us to build from the ground up, and I think that's important. Sometimes it's just a lot harder to try to build a facility when you're trying to modernize and you're trying to add and you're trying to use the facility. This is an opportunity to start fresh. It is an opportunity to build a building that is going to provide the newest of technology, the ingenuity of architects and engineers, and also the people who are providing the service. It is the ability to start from a very solid foundation and to get it right from day one. We have also reviewed, and I need to kind of comment what has happened, because I suppose some individuals in this room would say, well, geez, this isn't just another show, right? And we're going to put another sign up. Well, number one is, as was said, the money is in place. It's in the budget. It's there. So where are we at right now? First of all, 29 individuals applied for the qualification, if you want to call it. And so those individuals were looked at. 3 were selected, and that happened in the beginning of December. 3 were selected to look at the RFP, so to look at their proposals. So we have been looking at their proposals through January and part of December. And as I said before, to look at the ingenuity, to look at what they had in mind for technology, what they had as the design, what was offered in the community here before, and the work that was done before, looking at different systems and bringing forward their design plan and their concepts. So what happens now? I want to say this week, we have selected the individual that is going, or the individuals, the design team has been selected this week. We have to contact all the bidders that had applied or were part of the final RFP, and next week we'll announce that particular successful design team. What's going to happen next? They are going to bring forward, and it's part of the RFP. They're going to bring forward the design. They're going to bring it to the councils. They're going to bring it to the advisory boards, but more importantly, they're going to bring it to the community. So now I say to you, what happens then? What happens then is, if people are in agreement and we can get a final design and we can get a footprint in place, then we can start in the building of the hospital. So, in my optimistic world, and I call it optimistic, but some are more cautious than I am. But if we get the design in place, we are now working what we consider a progressive building. And people say, well, what does progressive building mean? It means that we don't have to have the designs right down to the final plug-in. But we have to have the designs that have the footprint, that have the ability to be able to progress at a building in a quicker rate. What does that mean? It means that we know what the footprint is going to be. We know what the exterior of the building is going to be. We know what the steel is going to be necessary to build. So we can contract that out, and we can still work on the other parts, the inside, when that first part is being built. No different than what we're doing in, let's say, another hospital in Sherwood Park or Strathcona. Is the grade beams are up, the pilings are done, the steel is going up, and we're still working on the design of what's necessary inside. That makes that build a lot shorter. And I think that's important for the projects that we have to have. So, somebody says, what's going to take place and when is it going to take place? If the process of consultation of what the footprint should be goes according to what I hope it does, I would suggest that that's going to end sometimes in the end of spring, beginning of summer. What does that mean? That means that the design is in place. Then the contractor, design team, will bring out bids to get some of the pylons done. I would suspect that in late summer we're going to start moving dirt. We're going to hopefully drill some pylons in late winter, hopefully, and I'm saying hopefully, and also start the grade work and the steel work. Because once we have that design finalized, we can already prepare to getting that steel done. Now, that's optimistic. On the non-optimistic side, I would suggest that we're going to start right in the beginning of January of the next year. But right now, I have no reason to think why it's going to take longer. When is it going to finish? My optimistic world, fall of 2013. My non-optimistic side, spring of 2014. So that's kind of the timelines that we have. But I guess I'm here to tell you that we have the land. As I said before, we have the funding. We've chosen the design team. Will be announced next week, and I want to say it's only the beginning, because I think it's so critical and important of the input that comes from the community. The Premier's vision and Premier, I say the Premier's vision and my mission, because you know, when as they say, as I think Robbins even coined it the odd time, was if the Premier thinks something is a good idea, I think I'm ecstatic about it, right? And in this particular case, the Premier's vision and my mission is not only to invest in the province's infrastructure, but really to deliver the most advanced infrastructure in North America. As I said before, the newest technology, the ingenuity that is necessary. And this is such a great opportunity because it is a new building. And we want to have hospitals as the crown jewels of our healthcare system. And each and every facility will be a model of how to deliver the healthcare infrastructure. Each and every hospital will be a testament that buildings work. And I say to you, as I said before, you know, you have to know, Robin does not allow me to speak, so this is my opportunity. And as long as I'm talking about his hospital, you see he's not objecting. Normally he'd be getting up and waving by now. So anyway, I talked about the consultation, and I talked about the hospital, and I want to say that we take. It's critical that whether we are treating loved ones or monitoring a patient or organizing records, or cleaning the floors, or driving an ambulance to an emergency, it takes a team approach to run a hospital. And we take the same team approach when designing and building the healthcare infrastructure in Alberta communities. I've been involved in sports and coaching for many years, and I always say I played with some of the best, and I learned quickly to value playing together as a team. I want to skip over some of the things that I was going to say about teamwork, because I think you know where I come from. I want to congratulate you, and I want to say to you that we need to do it right. We need to build it right. And I take that obligation, that trust, very seriously. Why do I take it seriously? Because of the work that volunteers did, because of the work that Ivan did, because of the work the municipalities did, the work that Robin did. This is a building of passion. This is a building of need. And it drives our approach to designing and building and maintaining healthcare infrastructure. It means working with the community and medical experts to ensure that this facility meets the needs today and into the future. I want to say to you that that's a very important point, because a hospital does not get built in a community for once every 5 years. It's like once every 50 years, once every 75 years. So what we look for in a design team is not for them to look 50 years in advance. It's for them to put themselves 75 years in advance and look back at what would be necessary to meet the needs of that time. That is critical to me. Alberta Infrastructure is working with the design team to ensure that your healthcare center meets the needs of Edson, meets the needs of Edson's community. You have my commitment that we will continue to work and consult with you, and we will deliver on our vision of providing the most advanced, state-of-art, and locally tailored healthcare center for Edson. Again, I thank all of you for being interested. I thank all of you for putting your heart in front of what we're doing here today. Thank you. So, you know, we have caucus coming up very soon, so I want to be the first to say to Robin, Happy Valentine's.
Thank you, Mr. Minister. Thank you to all our special guests for coming and speaking today.